Welcome to the Sage Women podcast, hosted by Melanie White and Dr. Nick Engera. We have real conversations with real women, health professionals, and coaches who share stories about perimenopause, menopause, and a range of women's health issues. Please subscribe so you get the latest updates every fortnight.
Hey, it's Melanie White here on the Sage Women podcast, and today I'm speaking to myself. Really, I'd like to cover a topic that's very important, improving mental wellbeing for midlife women. And I've delivered this recently as a series of lunch and learns to a number of organisations, had really great response and interest. And it's very important that we understand what the challenges are that we face at midlife, but also that women uniquely face. And so speaking to that gives people some awareness of what be triggering some stresses and potentially impacting mental well-being, and also some practical things that you can do yourself. And that's what I hope you take away from this session today. Also, I will say that this is not medical advice and it is not to be construed as medical advice. It is simply talking about some really common things that we should all be aware of, attentive to. So we'll talk about some of the surprising things that you may or may not know about women's mental health, those unique challenges that we face, why we need to be proactive in terms of managing mental well-being, and 5 simple evidence-based lifestyle changes that we can make to support better mental well-being. And I'd like to start with a couple of definitions from Smiling Mind, an online psychology organisation, and they're not for profit. And they define mental health as an overall state of psychological and emotional well-being, which is a continuum from mental illness to mental health. And overlaid on that is the continuum of being well and being in a crisis state. So there's kind of 2 axes to this. There's mental illness to mental health, and then how well we're functioning. Are we really well or in a crisis point? But we're not talking about mental health today. I think a really important point I will say before I move on is that Smiling Mind recognizes that mental health often conjures up negative things for people, negative words or feelings. And so perhaps we should look at changing our terminology, which I kind of agree with. I mean, talking about mental health does have its place, but for people on a day-to-day basis, what can we do to change the stigma around mental health? And what can we do to support ourselves better? And that's where the words mental well-being are perhaps more palatable and more positive, and perhaps easier to talk about openly. And isn't it interesting that we're talking about this? It's almost like a double-barreled taboo. We have mental health and mental well-being, which has its own set of stigmas and taboos. And then we have menopause and midlife women's health, which also has a set of stigmas and taboos. So talking about both of them at once is quite a lot. That's why if we break down that barrier and use the terminology mental being, it might be easier to start conversations. It might be easier for us to have constructive interactions to help people make positive changes. And so what is mental well-being? It's pretty much a state of positive functioning and life satisfaction. So positive function and life satisfaction on a day-to-day basis. And we can achieve those things by building up our mental fitness, which is a whole other thing we won't talk about today. What we'll talk about today is how to improve that mental well-being so that you can function positively and achieve that sense of satisfaction. Now, a few statistics I'd like to share with you about women's mental health. 33% of women experience anxiety at some point in their life. So that's from the Australian Bureau of Statistics. And interestingly, someone asked me, what about men? 20% of men experience anxiety at some point in life compared to 33% of women. So for women, it's a lot higher. Also, women, by virtue of the fact that they have pregnancies and go through menopause, are at risk of hormonally related depression. In pregnancy, we know that around 20% of women have postpartum depression. And during midlife, we're not really sure, but our interview with Professor Jayashri Kulkarni a few months ago indicated that somewhere between 20 and 60% of women have a hormonally related depression or mental health concern during menopause. So that's significant. They're two significant stages of life where even 20% of women is not. And then the third statistic, which may or may not be surprising to you, is that when it comes to depression and anxiety, 30 to 50% of those conditions are heritable. In other words, if you have a family history of anxiety and depression, you're more likely to struggle with those. Now, other health concerns or illnesses have higher rates of heritability. So it's something to be mindful of if you're thinking about managing your own risks and improving your own mental well-being. What is your unique algorithm? What is your history? What have been your life events that have come up that have impacted you? So I think really to set the scene, I'll give a bit of my own journey. And as a kid, I was a very shy, anxious person. I was terrified of having to speak out to other people. I found it hard to meet other kids. And I eventually outgrew that, but it was a real struggle for me as a child to get through that barrier of being able to speak up, hold my own in a social setting. I eventually became a company director and ran a successful business, but by the age of 35, I'd burnt out. And I moved from Perth to the other side of Australia where I knew nobody, and it was really hard to start again, especially whilst recovering from burnout. But I retrained. I was a biologist and I moved to health and wellbeing and completed various qualifications with a focus on coaching and built up a new business, which was great, very successful again. But age 49, I came along and I started to get really bad anxiety. I started to feel mild depression, and it coincided with the onset of perimenopause for me. That was a difficult couple of years. But now I'm in my early 50s. I'm 53 at the time of recording this podcast. And I'm essentially looking after myself with lifestyle strategies. I'm maintaining my mental well-being. And so that's a bit of my journey. That's ups and downs on a timeline. And I invite you to think about some of the things that may have been helpful for you or harmful for you when it comes to your mental well-being. I think some points I'd like to make is that we are all unique in terms of our vulnerabilities and protective factors for mental well-being. And as women, a unique set of challenges that we must face, which I'll talk about in a minute. And even one challenge, even one big thing in life, let's acknowledge that, because we tend to juggle a lot of things in life, which can overload us, overwhelm us, and impact our mental well-being. And of course, we know that your ability to navigate and bounce back from challenges is partly hereditary, but also there is a lot you can do for yourself to maintain your mental well-being. So let's think about some of those life events. In your 20s, you're trying to get through your education, finish a degree, maybe starting a new relationship, moving out of home, and starting this job. So there are quite some high impact life events happening there. And for some people, they cruise through those things. For other people, those things are difficult. In your 30s, you might be looking for career advancement, perhaps buying a home, getting married. And for women, it might be a time of childbirth, although this can happen earlier or later. But generally in their 30s, women are starting having babies these days. So that's a unique thing for a woman in her 30s to be dealing with, and possibly infertility issues or endometriosis or other women's health conditions. And what about in our 40s and 50s? Women face a gender pay gap. That is a unique thing that we face, that we deal with, which affects our financial security, our superannuation, and our asset and wealth generation for the future, coinciding with the fact that we've had to take time off work for pregnancy and are working into the era of perimenopause and menopause. And so we know that a portion of women are dealing with hormonally related issues, as I mentioned earlier, that can impact their ability to stay at work, to hold down a job, to go into career advancement, to maintain healthy relationships. So women and men are both facing a peak of career responsibility and family responsibility at this age. But women may be disadvantaged by the hormonal changes related to menopause and the gender pay gap. Plus, moving into these, we have the empty nesting syndrome. So we end up being that sandwich generation. also caring for elderly parents at that age, and 70% of care women. So this is once again perhaps something unique that women are needing to deal with. In our 60s, we are facing issues with financial security, and caring for others is still relevant. We're thinking about retirement. And women particularly are coping with maltreatment and grief and loss. So that's things like elder abuse or being dismissed. And in our 70s, we're thinking about where we move to, we manage chronic health conditions and so on. So there are a lot of things that come up in life, and some of us are really well equipped to manage those. For others, we find some of those things challenging. So think about your journey so far, and perhaps some of the things that you've been dealing with, and please acknowledge the amount of energy and effort it takes to bounce back from those things and to manage and navigate them. And I think that's why I want to really say that we need both a responsive approach and a preventative approach. Remembering that 33% of women at some stage in life will experience anxiety, and that we may also experience depression. We need to be responsive to that. For women in menopause, it might be about taking menopause hormone therapy or have some other treatment, or it might be going to a psychologist or taking antidepressants, depending on the case that you're facing. But we can also use preventative strategies. We can build our internal resources with those strategies, and those internal resources help us to cope in healthy ways, to bounce back, and to maintain mental well-being. So now I'd like to ask you how well you support yourself. For most people, when life gets busy and hard, self-care falls off the radar. We place time and investment into other areas like our relationships, our work, our family, and things fall by the wayside. We don't manage stress so well. Perhaps we start not sleeping so well, particularly if you have those hormonal overlays of menopause. A lot of people use alcohol to help them wind down or to socialize, which can be harmful and worsen mental health conditions. We may become sedentary as we're trying to do so many things and sitting at the desk all day getting them done. And at certain times of life, we might feel quite lonely and isolated, dealing with something that we think other people don't understand, or there is a taboo around them, a mental health concern, menopause-related issues that we don't feel comfortable talking about. So think about how well you support yourself in those areas: stress, sleep, alcohol intake, activity, and social connection. And knowing that there are a lot of things that you can do, and I'm going to talk about those 5 areas today, but there are many others, like nutrition, of course, is so important, and other things that you can do to improve mental well-being. The point really is, if you do these things, if you make these changes, then you're equipped and resourced to bounce back. You'll find healthy coping mechanisms. You'll have better cognitive function, energy, sense of control, sleep, quality of life, relationships, self-esteem, and hormonal balance, because we know that things like stress and poor sleep can be drivers of worsening, more severe, more frequent menopause symptoms in some cases. So let's talk about some of the things that you can do. And number 1 is stress management, or even better, stress prevention. Now, if you're a midlife woman listening to this, you know that you have far less time and energy right now than you ever did. And so you're being a bit more judicious with how you spend that time and energy. And that means that in terms of preventing stress, you might be finding it easier to say no to people, to set boundaries around things, to finish work on time, to reduce your working hours, to let go of toxic relationships. And all of those things are helpful. And you can also do other things. Body work is a category of things that you use to help you to calm your sympathetic nervous system. That could be massage, movement practices, and breath work. Even Tai Chi or Qigong, those sorts of things can be really helpful. Then there are mental strategies. And this can be a harder one because it's less tangible, but think about the way that you speak to yourself. Think about your self-talk about your body, your competence, your confidence, your skill, your capability, how much guilt you carry about different things. Really a great time to notice how you speak to yourself, to be the watcher and to change some of that language. Mindfulness is also a really helpful practice, and self-compassion is too. And there's a third category of ways to manage stress, which falls into life management. And really, these things include things like simplifying. Like I mentioned before, you've got less time and energy now. Be judicious. Clear out the clutter, get organized, let go of things that no longer serve you. Find hobbies and do creative things. In my experience working with women, those who have the highest stress levels do not have any hobbies, the opportunity to be creative. I believe that stress and creativity are the opposite things. So creativity can be a countermeasure to stress. So those are some ideas for managing stress. The next thing is a sleep routine, and a lot of people will talk about preparing for bedtime. But I think it's also worth mentioning that in midlife, we become more sensitive to certain things like caffeine and alcohol and spicy foods and eating animal protein. So some general rules could be, or considerations could be, to stop drinking caffeinated drinks before midday. Caffeine be in your system for around about 12 hours. So it's way better for you to stop drinking caffeine at 9 or 10 in the morning, knowing that the last of it will be clearing your system at 9 or 10 at night when you're ready to go to bed. That might improve your sleep quality. In the 3 hours before bed, you have a golden window to calm down your sympathetic system. So that means avoiding anything that gets your body going. Intense exercise, heavy red meat meals, alcohol intake, overeating, eating really rich fatty meals, and obviously switching off work. So that 3 hours before bed, not doing any of those things, finishing eating and drinking and working, and leaving a 3-hour gap for your system to wind down is really important. And then you can do the bedtime routine. But you need to also give your body and your body's function a break. In the 2 hours before bed, switch off your devices and screens to stop the blue and the stimulation of that engagement. 1 hour before bed, or even earlier, actually dim the lights. And if you can wake up at the same time every day, that's going to help you to maintain a good circadian rhythm and improve your sleep. So those are some things you can do for your sleep routine to help you sleep better in midlife. Of course, there are medications available, but these are lifestyle things that you can do. A third area is alcohol, which I mentioned earlier. Dwell on this, but I will say that alcohol makes mental health concerns and anxiety worse, as does poor sleep. And I should say actually that sleep is linked with about 70% of mental health concerns, and stress is obviously a driver of those things too. But what happens when you're stressed is that people turn to alcohol to help them wind down. And it's not just easy as switching alcohol for a non-alcoholic drink. That's part of it. But why are you drinking in the first place? What else could you be doing to wind down or to socialize and feel comfortable to fit in? So perhaps it's not about the alcohol. Perhaps it's about managing the underlying need, which could be very different. One of the most popular areas for women in midlife to tackle in the lifestyle areas is exercise. That certainly came up in Linda Deer's Meno Doctor survey, and it's come up in my surveys through these lunch and learns that I've been running. A lot of women turn to movement, and particularly Pilates, swimming, walking, and gym as the key things that they do to keep fit, to help them manage menopause, to improve sleep, to let go of stress. I like to think of it as must be fun and ideally involving friends, because then you tick 2 boxes at a time. And then you're more likely to be consistent, because exercise itself isn't so much the issue as doing it regularly. So if it's fun and you may be doing it with friends or in a team, it's going to be a lot easier for you to be consistent if you're that kind of person. The other thing is it needs to be functional. So in midlife, we go through musculoskeletal issues, and there is that musculoskeletal syndrome that women face with loss of bone mass and loss of muscle mass and increasing pain and joint issues. We need to think more about functional exercises, not going hard and fast so much as, although there is a place for heavy and high intensity work, but really thinking about daily movements that we want to do. Now, I remember when I first worked as a personal trainer when I went to New South Wales, the women that I was seeing were in menopause or in that transition period. Many had frozen shoulders, bad knees, injuries that had come up. And all they wanted to do was be able to get down, up and down on the ground to play with their kids or to wee in the bush. So think about what the purpose of the exercise is. Can it also include things that are going to help you to perform those daily activities and stay on your feet, maintain your balance, and build bone and muscle strength? And of course, the frequency. So we're looking at 150-minute moderate intensity exercise or 75 minutes of intense. Ideally, each exercise session is 30 to 60 minutes, but it can be less. If you want to break that up into a few minutes a day, that can be just as one session. At least you're doing something. And we typically think of exercises in terms of strength, flexibility, aerobic, and that's great and they're really important. We should do those things. But getting older means thinking more the mind-body connection. So really tuning in and being aware of your body, and also pelvic floor work, which should be done daily. Lots to think about. The final area is staying connected, and there is really important research showing women who are socially connected have better health outcomes, lower risk of chronic disease, and particularly lower risks of heart issues. Social connection buffers strengths and improves emotional well-being. Find social opportunities at work through volunteering, through travel, through sport. If you're an introverted, if you're feeling a bit isolated and lonely, it can be hard though. So what could you do if that's something that you're struggling with? How could you create enough social connection in your life to help you maintain or improve mental well-being? It could be jumping on the phone to a friend. It could be joining an online group where you participate when you feel like it. It could be jumping onto webinars or networking events. It could be being part of a hobby group. So thinking about what you feel you can do rather than what you can't, to start making moves in the right direction. Now, I've talked about a lot of things today. We've talked about those 5 lifestyle habits, and it's not about doing everything. I think the most important thing for today is that you think about one area you really would like to work on and improve, and one small thing you could keep doing, either to start doing or to be more regular with. And it will help you to be fairly specific about this. For example, if I'm not doing activity today, but I decide I'd like to get back into cycling, I might say, okay, this week I'm just going to do one 10-minute session on my bike and ride around the block. I'm going to do it on Friday after work. So it's small, bite-sized, achievable, fun, and not too overwhelming. And you can build up over time. And that's the whole principle of building habits. It's not about starting at the end. It's about incremental changes and building up to something. You've got to learn how to fit these things into your busy life and around your energy levels right now. So please take it easy, pick one thing and focus on gradually. And I guess some key points from today are that mental health concerns really are common in women. Mental being and lifestyle habits are bidirectionally related. That is, one improves the other and one can impact the other. And my question to you is, why wait until you feel terrible? Get the support you need, find a way to plan, schedule, create goals to improve your lifestyle habits so that you can achieve that state of mental well-being, positive function, and life satisfaction. I guess that's it from me today. I just really would like you to think about, how can I improve my self-care? A final thought on that. We talk about being selfish and we talk about being selfless. What's in it all? I think that's where self-care fits. It's not selfless and not selfish. It's investing in ourselves so that we can continue to function and perform as we would like to be there for others, to do our jobs, to live a meaningful and purposeful life. I hope you found this useful. I look forward to seeing you on the next episode. Bye for now.